Learn English free. G'day mates, ever been to a hospital? They can be a bit scary, right? Especially if you don't know the lingo. Knowing some basic hospital words can make things easier. You can tell the doctors what's wrong and understand what they're saying. It's like learning the secret code to feeling better. Ready to crack the code? Let's go. First up, let's meet some important hospital helpers. This is the word for the person who helps you feel better. They wear a white coat and know all about medicine. Nurses are like superhero sidekicks. They help the doctor and take care of you. This special vehicle rushes people to the hospital when they're sick or hurt. Imagine a sunny day. Birds are chirping. Inside the hospital, people are waiting patiently. A kind doctor talks to a little boy with a bandaged knee. "Just a little scratch, mate. You'll be right as rain in no time," the doctor says cheerfully. Section 4. Where does the ambulance go? Have you ever wondered what happens when an ambulance rushes through the streets with its sirens blaring and lights flashing? It's a fascinating journey that begins the moment someone calls for help. Let's take a closer look at where the ambulance goes and what happens next. Learn English free. Hospitals have different rooms for different things. Each room has a specific purpose and is designed to provide the best care for patients. For example, there are rooms for surgeries, rooms for recovery, and rooms for consultations. Understanding these different areas can help you feel more comfortable if you ever need to visit a hospital. It's like a big puzzle. Emergency room. The emergency room, often abbreviated as ER, is one of the most critical areas in a hospital. When an ambulance arrives, the paramedics quickly assess the patient's condition and decide if they need immediate attention. The ER is equipped with all the necessary tools and medical staff to handle urgent situations, from broken bones to severe illnesses. This is where the ambulance brings people who need help fast. ICU, Intensive Care Unit. The Intensive Care Unit, or ICU, is another vital part of the hospital. This area is reserved for patients who are critically ill and require constant monitoring and advanced medical care. The ICU has specialized equipment and highly trained staff to ensure that patients receive the best possible treatment. This area is for people who are very sick and need extra special care. The doctors and nurses in the ICU work around the clock to provide life-saving treatments and support. They monitor patients' vital signs, administer medications, and perform procedures to stabilize their condition. It's a place where every second counts, and the medical team is always ready to respond to any changes in the patient's health. This is where you wait your turn to see the doctor. The waiting area is an essential part of the hospital experience. It's a place where patients and their families can sit comfortably while waiting for their appointment or for news about a loved one. The waiting area is often equipped with chairs, magazines, and sometimes even a television to help pass the time. It's a space designed to provide a sense of calm and reassurance during what can be a stressful time. See? Hospitals aren't so scary when you know what everything means. By understanding the different areas of a hospital and what they are used for, you can feel more at ease if you ever need to visit one. Hospitals are places of healing and care, where dedicated professionals work tirelessly to help people get better. So the next time you see an ambulance rushing by, you'll know that it's on its way to a place where lives are saved and hope is restored. Section 5. What to say when you're feeling sick. Learn English free. Now, what if you need to go to the hospital? Don't worry, mate. It's completely normal to feel anxious or unsure about what to say when you're not feeling well. But don't worry, we're here to help you out. Here are some handy phrases. I don't feel well. This is a simple and direct way to let someone know that you're not feeling your best. It's a good starting point for any conversation about your health. This tells the doctor you need help. My tummy hurts. This phrase is especially useful if you're experiencing stomach pain or discomfort. It's clear and to the point, making it easy for the doctor to understand what you're going through. You can point to the part of your body that's sore. I need a doctor. This phrase is crucial if you're in a lot of pain or if you think you need medical attention right away. It's a clear and urgent way to communicate your needs. This one's important if you're feeling really bad. Sometimes when you're feeling really sick, it can be hard to find the right words. But remember, it's always okay to ask for help. Whether you're at home, at work, or out and about, there are always people around who can assist you. Don't be afraid to speak up and let them know how you're feeling. Another useful phrase is, "I think I have a fever." This can help the doctor understand that you might be dealing with an infection or illness that needs to be checked out. If you're feeling dizzy or lightheaded, you can say, "I feel dizzy." This will alert the doctor to a possible issue with your balance or blood pressure. If you're experiencing a specific symptom, like a headache or a sore throat, you can say, "I have a headache," or "My throat hurts." These phrases help the doctor pinpoint what might be wrong and decide on the best course of action. It's also important to mention any other symptoms you might be experiencing, even if they seem unrelated. For example, if you're feeling tired or have a loss of appetite, you can say, "I've been feeling really tired lately," or "I don't have much of an appetite." These details can provide valuable clues to the doctor and help them make a more accurate diagnosis. Remember, the more information you can provide, the better. Don't be afraid to speak up and share how you're feeling. Your health is important, and the more the doctor knows, the better they can help you. So next time you're not feeling well, remember these phrases. They can make a big difference in helping you get the care you need. Stay safe and take care of yourself. Section 6, Quick Recap. Hospital words to remember. Learn English free. Good on you, mate. You've learned some important hospital words today. These words are essential for anyone who might find themselves in a hospital setting, whether as a patient, a visitor, or even a healthcare professional. Understanding these terms can help you communicate more effectively and ensure you get the care you need. Let's do a quick recap. It's always good to review what we've learned to make sure it sticks. Repetition is key when it comes to learning new vocabulary, especially in a context as important as healthcare. Doctor, the one who makes you better. Doctors are medical professionals who diagnose and treat illnesses. They have extensive training and are responsible for making critical decisions about your health. Whether it's a general practitioner or a specialist, doctors play a crucial role in the healthcare system. Nurse, the doctor's helpful assistant. Nurses are the backbone of any hospital. They provide care, administer medication, and support both doctors and patients. Nurses often spend the most time with patients, offering comfort and ensuring that treatment plans are followed. Ambulance, the speedy vehicle that gets you to the hospital. Ambulances are equipped with medical equipment and staffed by paramedics who provide emergency care on the way to the hospital. They are crucial for transporting patients quickly and safely, especially in life-threatening situations. Emergency room, for urgent situations. The emergency room, or ER, is where you go for immediate medical attention. It's staffed by doctors and nurses who specialize in emergency care, whether it's a broken bone, a severe allergic reaction, or any other urgent medical issue. The ER is equipped to handle it. ICU, for very sick people. The intensive care unit, or ICU, is for patients who need constant monitoring and advanced medical care. These patients are often critically ill or recovering from major surgery. The ICU has specialized equipment and highly trained staff to provide the highest level of care. Waiting area, where you wait patiently. The waiting area is where family and friends can stay while their loved ones are being treated. It's important to be patient and respectful in this space, as everyone is there for someone they care about. Hospitals often provide comfortable seating and sometimes even refreshments to make the wait a bit easier. Now you're all set to navigate the world of hospitals with confidence. Knowing these terms will help you understand what's happening around you and communicate more effectively with healthcare professionals. Whether you're asking for directions to the ICU or understanding a doctor's instructions, these words are your key to navigating the hospital environment. Remember, knowing the right words can make all the difference. Stay healthy, everyone. Being informed and prepared can reduce anxiety and help you feel more in control during hospital visits. So keep these words in mind, and don't hesitate to ask questions if you're unsure about anything. Your health and well-being are the top priority. Thanks for watching my channel. Learn English free.